A shockingly high percentage of Prince George's residents are uninsured. That's according to a new data from the U.S. Census Bureau. 16% of the county remains without health insurance. The data also shows counties that have a large number of low-income residents and minorities are the ones with the highest rates. There are currently more than 700,000 Marylanders who are without health insurance. And if you don't have health insurance because you have a pre-existing condition, you may qualify for coverage under the Affordable Care Act. Pamela Creekmur is the health officer for Prince George's County, and she joins us now in the studio to talk more about the Maryland Health Insurance Program. Thank you so much for being here, Ms. Creekmur.
Thank you for having
me.
me.
Now, you saw this piece that we ran earlier, and are you seeing as your role as a health officer that this number is prevalent in the county and is affecting us?
Yes, so we do. We in the state there are about 720,000 people who are uninsured, and particularly in Prince George's County alone, we have estimates of about 160,000 people who are underinsured or not insured.
Okay.
In our county.
And are those numbers increasing with the difficult economic times?
It is linked a lot with jobs. The majority of people have their health insurance through their work, through their jobs, and the economy does play a factor. But we see a variety of reasons. There are working people who have jobs who also don't have insurance.
Now, do you think with the passage of the Affordable Care Act, these numbers will go down?
Absolutely. We expect that a large percentage of people will be eligible for health insurance and required to have health insurance. We do expect there'll be a small percentage of people who will not be eligible for insurance or may choose to take the penalty over having insurance, but we're excited about the Affordable Care Act.
Tell our viewers a little bit about that. What are some of the changes that they will see, and how will people be directly affected?
Well, people will be eligible for health insurance with the Affordable Care Act, where before, for the program we're talking about today, the MHIP program, it's a program designed for people who have not been able to get insurance because they've had a pre-existing condition. And this program allows them to have health insurance. They have to have been uninsured for 6 months or more, and they are eligible for a health insurance policy similar to commercial plans that are out there for others. With the Affordable Care Act, in 2014, the majority of our residents will be eligible. As long as you are a legal citizen, you're going to be eligible for some type of health insurance, whether it's subsidized or not, based on a variety of things.
Now, the MHIP program that you talk about, how do you think that program will directly impact Prince George's?
Well, it's available today, and that's the great thing about the MHIP program. It is an option for people who have not had insurance for 6 months or more, as I said. They also have a pre-existing condition, and prior to 2010, insurance companies could not provide you care just based on that. And so people can go on our website, which is getmdhealthcare.com to look at some of the details around eligibility and specifics, but it's available today. And I think that the residents of Prince George's County, for the most part, might not be aware of this program.
Sure, and we certainly appreciate you coming in and giving us more information. Now, are there any other programs that people may not be aware of?
Well, one of the problems I think we face is that there are a lot of resources available and many people aren't necessarily aware. So there are people who are eligible for a variety of insurance today that they may not know that. The health department provides a role, and we have a line called the Health Line, and I am so sorry because I don't have that number written here, but it's on our website where you can call and find out about options and available insurance plans for you, whether it's medical assistance, this MHIP program. We refer people who even don't have options to some of the safety net options that will be available for people who aren't insured as well.
Well, we thank you so much for coming in. Unfortunately, our time has run out, but we'll give that website out one more time. To learn more about the Maryland Health Insurance Plan, you can log on to getmdhealthcare.com. Thank you again.